Imagine for a moment, you're going about your day, perhaps feeling a little stressed, when suddenly, without warning, your breath catches. You find yourself gasping, struggling to pull in enough air, even though your lungs feel empty. Your chest tightens, your heart pounds, and a wave of panic washes over you, leaving you convinced something is terribly wrong, perhaps even life-threatening. This frightening experience, often mistaken for a heart attack or severe respiratory issue, is a common and distressing symptom of anxiety, shortness of breath. Welcome. Today, we're going to explore this perplexing symptom, medically known as dyspnea, and peel back the layers to understand why anxiety can make us feel like we can't breathe, even when our lungs are perfectly capable. It's a sensation that alarms millions, driving countless visits to the emergency room, and for good reason. It feels incredibly real and urgent. But understanding its roots and our body's natural defense mechanisms can be the first step towards finding relief and regaining control. So, why does anxiety trigger such a visceral and alarming sensation of breathlessness? The answer lies deep within our primal fight or flight response. Think of it as your body's ancient alarm system, designed to protect you from danger. When anxiety kicks in, whether it's from a looming deadline, a difficult conversation, or an overwhelming situation, this system activates. Your sympathetic nervous system goes into overdrive, flooding your body with stress hormones like adrenaline and cortisol. These powerful chemicals prepare you for immediate action, to fight the threat or flee from it. Part of this preparation involves a change in your breathing pattern. You start to breathe more rapidly and shallowly, a phenomenon known as hyperventilation. Now, here's where it gets a little technical, but it's crucial for understanding. Hyperventilation means you're breathing faster and deeper than your body actually needs. You're taking in plenty of oxygen, but you're also exhaling too much carbon dioxide. Carbon dioxide isn't just a waste product. It plays a vital role in balancing the pH of your blood. When you breathe out too much of it, your carbon dioxide levels drop, leading to a state called respiratory alkalosis. This shift in your body's chemistry is what triggers those uncomfortable and confusing symptoms. Your blood vessels might constrict, leading to dizziness or lightheadedness. You might experience numbness or tingling in your hands and feet. And critically, despite having enough oxygen, you get that subjective, overwhelming sensation of air hunger, the feeling that you can't get enough breath, that your chest is tight, or that you're suffocating. It's a truly frightening experience. And here's the cruel twist. This feeling of breathlessness then intensifies your anxiety, which in turn worsens your breathing symptoms, creating a self-perpetuating, vicious cycle. It's like being caught in a loop where your body's attempt to protect you ends up making you feel more distressed. What's also fascinating, and a growing area of research, is the role of interoception, our perception of internal bodily states. Some studies suggest that anxious individuals might not be hypersensitive to subtle changes in their breathing, as one might assume. Instead, they might have a blunted sensitivity. This means they only perceive changes after a significant deviation, leading to a sudden, overwhelming, and terrifying sense of distress, rather than a gradual awareness that allows for adjustment. It's like the alarm only goes off when the fire is already raging, rather than at the first wisp of smoke.
Beyond breathlessness, anxiety can manifest with a host of other physical and mental symptoms. You might notice an increased heart rate or palpitations, that feeling like your heart is racing or skipping beats. There's often chest tightness or a dull ache, dizziness or feeling faint, sweating, chills, nausea, stomach discomfort, trembling, shaking, or generalized muscle tension. Mentally, anxiety can bring on nervousness, a sense of impending danger or doom, difficulty concentrating, and even a dry mouth. Recognizing these associated symptoms can help you connect the dots and realize it might be anxiety at play. Now, it's absolutely vital to address the biggest concern that often arises when someone experiences anxiety-induced shortness of breath: the need to distinguish it from serious underlying physical conditions. This is why this topic trends so frequently, and why so many people seek information and medical help. The feeling of breathlessness can mimic symptoms of a heart attack, asthma, or other severe respiratory issues. Therefore, if you experience new, severe, or persistent shortness of breath, especially if it's accompanied by what we call red flag symptoms, like radiating chest pain, blue lips, or confusion, you should always seek medical evaluation immediately. A doctor can rule out physical causes and provide peace of mind. However, once serious physical conditions have been ruled out, medical professionals often reassure us that while anxiety or panic attacks are incredibly frightening, they are not life-threatening in themselves. You will not suffocate, and your heart will not give out. Understanding this can be a powerful first step in managing the fear that fuels the cycle. So, what can help when anxiety makes it hard to breathe? The good news is there are many effective strategies. First, let's talk about breathing techniques. Since hyperventilation is a key player, consciously regulating your breath can be incredibly powerful. Diaphragmatic or belly breathing. Instead of shallow chest breaths, focus on breathing deeply into your abdomen. Place one hand on your chest and the other on your belly. As you inhale, feel your belly rise. As you exhale, feel it fall. This helps slow your breathing and engage your diaphragm, a more efficient way to breathe. Slow, deep breathing. Try counting as you breathe. Inhale slowly for a count of 4, hold for 1, and exhale slowly for...
In some cases, medication might be a helpful tool, particularly when anxiety is severe and impacting daily life. Anti-anxiety medications, antidepressants, and sometimes beta blockers, which can help manage physical symptoms like a racing heart, can be prescribed by a doctor or psychiatrist. This is always a decision made in consultation with a healthcare professional to find the best individualized approach. Finally, lifestyle adjustments play a crucial role. Regular exercise is a powerful antidote to stress and anxiety, helping to regulate hormones and release tension. Avoiding stimulants like excessive caffeine and nicotine can also make a big difference, as they can exacerbate anxiety symptoms and make you feel more jittery or restless. The understanding of anxiety-induced shortness of breath continues to evolve. Researchers are delving deeper into neurophysiological mechanisms, especially how the brain processes breathing sensations in anxious individuals and the nuances of interoceptive sensitivity. This ongoing scientific inquiry promises more nuanced insights into the anxiety experience and will likely inform the development of even more effective and personalized treatment strategies in the future, recognizing that what works for one person might not work for another. In closing, experiencing shortness of breath due to anxiety is a deeply unsettling and very real phenomenon, but it's also a highly treatable one. While it can feel terrifying, remember that it's your body's alarm system misfiring, not a sign of imminent physical collapse. The most important first step is always to consult a healthcare professional to rule out any underlying physical conditions. Once cleared, you have a wealth of strategies, from simple breathing exercises to comprehensive therapy and lifestyle changes, that can empower you to regain control of your breath and your peace of mind. Be kind to yourself, listen to your body, and know that help and understanding are available. You don't have to face this alone.